Doctors of Reddit, what are the dead giveaway signs that someone is faking? I'm a nurse on the floor that deals with a lot of chronic and acute pain patients. Most recent instance was this lady from a few weeks ago that was apparently splitting the oxycodone we were giving her in half in her mouth, and then when the nurses' backs were turned, she would stuff it in a pill jar. A night nurse caught her in the act and all of her shit had to be searched. We found 20 half tablets of oxycodone she had been stashing. She told us that she was saving them for her family in case they need them because it's just so hard to get an oxycodone prescription these days. I had her a few days after that, and she was having some abdominal pain. Stat X-ray showed only gas. She just really needed to fart, but she was screaming, claiming it was a 10, and making a huge fucking scene. She demanded Dilaudid through her 4, and she wanted it to be pushed fast. Huge red flag right there. She wanted the high, not the relief. Doc straight up said he wouldn't give her Dilaudid because she was already on so many opiates. She then demanded lorazepam, still through her IV of course. Doc was like fine whatever, just one time and only a low-end dose. I was flushing her IV with normal saline first, to make sure her IV was patent, and she leans back and is like oh that's so much better already. Hadn't even given her the lorazepam yet, SMDH. Obligatory, not a doctor, but I got a call from my son's school nurse when he was in 2nd grade, and the conversation went like this. Nurse sounding upbeat and cheerful says, "Your son wants to tell you his terrible news." Son gets on the phone, says, "Hi mom, I cut my finger off." I ask him, "Where is your finger now?" "Son, I put it back on." I said, "Can I talk to the nurse?" Nurse gets on the phone again, says, "Sounds serious, right?" I asked, "Does he have a substitute teacher today?" Yes. I told the nurse to let him know I will take him to the hospital for a shot for his finger, to which he says I think it's okay. I glued it on really good. Nurse kept him in the office for a bit to talk about scary changes in the classroom. Did he make a full recovery? He has to reapply the glue occasionally, but otherwise he's fine now. Yeah, that's actually rather common when the patient opts to not go to the hospital for the reattachment shot. A shot at reattachment, I'm in, whenever the symptoms aren't there, when the patient doesn't know they're being watched. I had someone fake a stroke recently and walked in on her walking around her room independently, after pretending to be limp on her left side, letting us take complete care of her and wiping her butt for her. It was wild, y'all. Why would anyone fake any of this stuff, but especially a stroke? What is the point? Edit. Wow. The number of responses is crazy. Here's a synopsis. Munchausen syndrome / factitious disorder. Attention / sympathy seekers. Loneliness. Homelessness / warm bed. Get out of jail / schoolwork / malingering. Insurance fraud / welfare fraud. Disability money. Don't want to work. Narcissistic personality disorder. Get drugs. Amplified musculoskeletal pain syndrome. General mental illness. Caregiver fetish. Hypochondria. And one user said, "Women will do anything to get out of working. Dude, she didn't have to wipe her butt anymore. Totally worth it. Born to shit. No longer forced to wipe." That's a quote for the bathroom walls. I'm gonna put that up, thank you. I'd just get a bidet and call it a bidet. A bidet to you, sir. My ICU attending has a great story about caring for a stroke patient during his fellowship. The stroke patient was a frequent flyer, and despite everyone knowing that she was faking her paralysis, she still received care. Until one day when he was really fatigued, he was told by a nurse that the patient was being rude and refusing therapy. So he walked into the patient room and said, "Ms. Blank, this is absurd. I know you're faking your paralysis. Everyone knows you're faking, we are all sick of this," and left. The patient walked out. AMA. Edit. To clarify, AMA is against medical advice. And to address the people who ask if her leaving is even considered against medical advice if she wasn't paralyzed, the answer is yes. She was admitted to the hospital under the care of physicians and left without being properly discharged, which strictly speaking is AMA. Also, this isn't my story. My attending physician, the doctor who is training me, told me about this patient that he treated 20 years ago, so I don't know more details. It took me too long to realize that AMA meant against medical advice and not ask me anything. Not a doctor but a paramedic. Tons of calls to the jail for inmates with seizures. I lift the arm over their face and let it go. They'll move it to prevent hitting their face, or I'll lightly brush their eyelashes and they'll twitch to it. That's genius. I have had a few seizures and the injuries I've had from falling and thrashing are pretty legit. It would take a hell of a lot of dedication to fake those. That's the thing, though, people often don't fake them well. Someone I knew in nursing school had the experience of a patient who didn't realize they could be seen carefully getting out of bed, climbing over the bed railing to keep her from falling, laying down the floor, and then rolling around while screaming. I worked at a psych hospital and I've literally had people saying I am having a seizure. I wheezed. That's amazing. I have invisible seizures and it's annoying as fuck because no one notices it, and due to ADHD people just assume I don't pay attention. Took me 10 years before I raged at my doctor, and it took 20 minutes to find out I definitely had epilepsy. This reminds me of the time we were getting ready for an exam and one of the fellow students pretends to have a seizure to get out of it. Pass or fail med test. She must have forgot to study. I shit you not, this bitch pisses her pants to pretend it's real. Security knew she was faking because she would track the light with her eyes. Wow, security knew more about it than her. She would have known more if she had studied for the test. My wife is a doctor and she had dealt with people faking things like one of their legs simply not working. The trick is to tell them to do some other thing with a positive phrasing, making it seem like doing so will prove the patient's story is true, while it proves the opposite. This works for both people who are actively faking it and people who have subconsciously convinced themselves the problem is real. For example, if they say their right leg can't move, you first ask them to try lifting it, which they try and obviously fail to move or flex any muscles in it. Then you act intrigued and say something like, now your left leg is the one that works fine, right? Go ahead and lift it up for me for comparison. While they are doing this, you still casually have your hand on their right leg, which you had placed there when you were feeling for any activity when they tried to lift it. Now when the person is laying there and lifts their left leg to prove their right one doesn't work, they will naturally flex their right leg to provide balance with their left leg in the air. If they are able to flex their right leg then but won't even flex it when they claim to be trying to move it, then you know their leg still works. You just have to narrow down if they realize are faking it intentionally. Anyone else sitting in the dark lifting their left leg, with a hand on the right, trying to convince the imaginary doctor that their right leg don't work?